All right, in this video presentation, we're going to be exploring different weight loss methods, different weight loss options. We're going to be talking about the pros and the cons of each, the similarities, the differences. The purpose of this video is to help individuals find their best path forward. So hopefully by the end of this video, you'll have enough knowledge to make a decision on what is best for you. So first, full disclosure, my name is Dr. Matthew Nussi of Brand New Weight Loss, and Brand New Weight Loss does have a proprietary mobile app, and it also has several physical locations, and we focus on permanent and natural weight loss. But I can tell you without a shadow of a doubt that what we do is not best for everyone. So when I get to natural weight loss, I will be talking about the pros and the cons as well. So what works for one is not going to work for everyone. What's right for one person is not right for everyone, and we're not right for everyone. That's why we take everybody through a screening process, either on the mobile app or physically in our office. And again, the goal at the end of the day is to help you have enough information to make the right decision for you. All right, let's get into the presentation. So first off, we're going to be talking about two basic types of weight loss programs. So the first is medical, and we will define medical as requiring a licensed physician to oversee the program. So there are going to be two types of these: surgical and prescription medications, taking a prescription that a licensed physician has to prescribe to you. And then we'll also be talking about natural weight loss. And natural weight loss, we're going to kind of all lump together. There are many different ways to attack it, but we're going to lump them all together, and I'll get to why later in the presentation. But we're talking about dietary modification, nutritional supplementation, exercise can be a component as well, and probably what is best is some kind of combination of all three. All right, so let's start from the top. We'll talk about surgical weight loss first, pros and cons, what it's all about. So again, the positives of surgical weight loss is that basically the physician does all the work for you. You go in, have the surgery performed, and then basically you're not able to take in as many calories as you were before. It's basically forced willpower. So they're reducing your stomach size or your body's ability to take in the amount of food that it used to be able to take in. So very little effort required. That's the main positive. The other big positive is that a massive weight loss is possible and sometimes even probable. And this is mostly true for morbidly obese individuals, individuals that have many pre-existing conditions. All right, so let's talk about the negatives. The one right off the bat is this is major surgery. There are obviously risks with any major surgery, this one included, risks including anesthesia, difficulty with bleeding, surgical mistakes, etc. And again, the risks increase in this scenario because this surgery is usually performed on an already compromised patient group. So it's expensive as well if you cannot get your insurance to cover it. The average that I found looking at online is about $20,000 for one of these surgeries. Again, in certain instances, you can get insurance coverage. And again, from one study, and the study is weight regain after bariatric surgery, scope of the problem, causes, prevention, and treatment 2023. So you can very easily Google search this. From 37% to 76% regain a significant amount of weight that they lost by having the surgery. Now, the surgery, here's again what might be true for the surgical route if you are thinking about going that way is there are certainly risks, but the benefits may outweigh the risks. Again, we're talking generally here about individuals that their life may be threatened if they continue to stay at their weight or continue to gain weight. So it kind of almost is like a last ditch effort or a last resort. Okay, next we will talk about the other side of the medical option, and that is medication. And this has gotten very popular, and it seems to spike in popularity and then kind of die off and spike in popularity. There was phentermine, very, very popular for a while. Belviq came out a while back, and now we're talking about semaglutide drugs, mounjaro, wegovy, things like that. And again, we're just going to go through the medication positives and negatives, the pros and cons. The pros, again, just like surgery, is there's very, very little effort required. You take a medication and hopefully you see the results. The medication basically is what's causing the weight loss. So you don't have to do much more than either take an injection, take a pill, something like that. That's basically it as far as the positives go. This is for people that don't want to put in that much effort, to be honest. The negatives, it can be extraordinarily expensive as well, and this is an ongoing expense. So the surgery was a one-time expense, and maybe there are a few ongoing expenses, but as far as a medical option, you have to generally continue to take the medication. Again, an average about $1,000, maybe a little bit more a month. And again, insurance really isn't covering this right now. That could change in the future. Even if insurance does cover some of the cost, there is going to be a lifetime monthly cost for this, even if it's a little bit lower than the number that I could find. Side effects as well. Again, we're talking about taking medication. Medications often come with side effects. Depending on the drug that you're taking, feeling jittery or ramped up, not being able to sleep. Digestive problems is a lawsuit. Again, I did a video on this a while back. It's called stomach paralysis. There have been a couple lawsuits about these new drugs causing stomach paralysis, etc. So you definitely want to understand the risks involved, the side effects involved before you take a particular medication. And again, you generally must take these medications for life to continue to see the benefit. Once you discontinue taking the medication, all signs point to patients regaining the weight that they lost. All right, so we will move on now to natural. And again, we're lumping natural, everything natural, all into one for a very specific reason. So this includes diet modification, exercise, use of supplements, and even shake diets. Those are still around. I still have people come into my office and say that they have done a shake option in the past. So anything that isn't physician required, a physician is not required to oversee or manage or prescribe or do a surgery. Now, a physician may still develop and oversee one of these programs because that's what they feel is best, but it is not required. All right, so natural weight loss, and again, we'll talk about the positives and the negatives, and we're kind of, again, lumping all natural techniques in together. First thing, positives. It is the least expensive by far. Obviously, when you cross over and do something medical, modern medicine, especially in the United States, is extraordinarily expensive. So when you do something medical, it's going to be more expensive than doing something naturally. And it varies depending on if you actually can do it by yourself, or if you hire a trainer or nutritionist or do some actual program. But even our programs are multiple times cheaper than any of the medical options. That's for full programs. And next is that you learn habits, hopefully for life. So you can learn what to do, you can go through challenges, and you have that knowledge to hopefully be able to use for life. And that's very important for permanent weight loss. And you feel a sense of accomplishment when you put in effort and you attain a goal, and you feel like what you specifically did, the work that you put in, actually led to the success. There's a lot of gratification in that, and that can help keep you motivated. All right, so let's talk about the negatives, because certainly there are some, and this is the biggest one. This is one that causes people to fail the most. This is obviously where the most effort is going to be required. So the person trying to lose weight does have to put in effort here. They have to potentially learn to cook, make certain sacrifices, change their lifestyle in certain ways. Exercising can seem inconvenient. So there's certainly effort that if you are going this route, you want to understand. Next is there is a minefield of choices. So unfortunately, there's all kinds of gimmicks and gizmos and gadgets and magic pills. You want to fully understand what you're getting yourself into so you make the right choice, because making the wrong choice about a natural approach and then putting in effort, making changes, and then feeling like you just can't do it can be very defeating, and it can cause you not to want to do it again, even if there is a program out there that's right for you. Again, the screening process, what we take our clients through, I feel is extraordinarily important as far as this goes. So there's a minefield of choices. And regaining of weight. So the fact that you regain weight, or the amount, the percentage of time that you're going to regain weight, or a client is going to regain weight, is very dependent on if they make the right program choice. So that's why I'm kind of grouping exercise and dietary modification and supplementation all together into just natural weight loss, because the recidivism rate, or the rate at which somebody will regain their weight that they lost, is pretty dependent on making the right choice, finding a program, fully vetting it, and then fully committing to it and seeing it through. So the recidivism rate is, again, going to be dependent on if you make that right choice. Now let's answer kind of an elephant in the room question. Very important question, probably one that you're asking watching this video. I hope that you are asking when you're watching this video. Wouldn't a combination of medical, perhaps, and dietary modifications and maybe some exercise be the best? Here's my experience, is in theory, maybe it would be the best. But what I have found in practice after doing this for 15 years, researching it heavily, looking at articles, is that in practice it rarely works. In practice, if you kind of are if you're the kind of person that either needs surgery or wants to just rely on medication, you never really take to the changes that are needed to be able to then get off the medication and then be able to maintain your weight long term. So really, it does seem like it's an either or kind of situation. Again, there's going to be individuals that did a medication, did a surgery, and then really focused on the nutritional aspects going forward and are able to be successful kind of combining them all together. But what I've found is that until you from the beginning commit to, I'm going to do this naturally, I'm going to exercise, I'm going to change the way that I'm eating, I'm going to take these supplements, and I'm just going to focus on losing weight steadily over time, that's what really changes the habits that are able to stick long term. And if you interject with potentially a medication or a surgical procedure, that's just so easy that you kind of get reliant on, again, the medication or the surgery doing it for you. All right, so here's kind of the bottom line to all of this. So think of it this way: when you go from a medical to a natural approach, what you're basically doing is you're trading money for effort. So if you're using a medicine or doing a surgery, you're basically paying for what you could potentially do, and you could do naturally. Without a shadow of a doubt, everyone can do this naturally. You just might choose not to. You might choose to pay the expense, the higher expense, and have the medicine or the surgery done for you. And again, in some cases, the surgery or maybe even the medication is necessary. All right, so that is the presentation. I hope you found this helpful. I hope this helps you find your path forward. Remember to find your path, not what your friend did, not what your relative did. Just because they had great success, you need to find out what you need to do. So do your homework, vet a program or a method or a medication before you undertake that particular procedure or route. And until next time, everybody, stay happy, stay healthy, and I'll catch everyone in the next video.